So hello guys, welcome to the MPT Interest channel, and in this video we are going to discuss about the piano key sign, its clinical and the examination aspect. So if you're new to here and you didn't subscribe our channel, please subscribe the channel and hit the bell icon. So to understand the piano sign, what exactly it is, what I'm going to discuss about this and why I'm going to discuss about it, because it has a very prominent role when you are going in your clinical practice or when you are going to give your exam. So most of you have been through your internship days, or maybe you are doing the internship days and you are finding time to study about reading about the MPT entrance. So when you open the book, specifically Maggie, for orthopedic rehabilitation examination, you typically come across this sign where you have a beautiful this image, and you have this prominent deformity present in the shoulder. So let's say if you are suspecting any sort of this, um, any sort of question regarding this, what anatomical structure are going to be hampered? First, this could be asked. Second, what neurological involvement could occur due to this? What myofascial, like myofascial or the muscular involvement occur at this particular point? So these are the three important aspects which could be asked to you specifically in this particular question. So again, I'm going to define you, this is a particular area of our interest. It may hampered because from here, it may hampered because of here, or directly a traumatic event which can be hampered and result in this deformity. So, considering the fact, first let's explore what the name suggests. As the name suggests, as the video's title suggests, it has a piano sign. So, you must all aware about the piano key, what a piano, a musical instrument is. So, when we go for a piano, we see this low pitch sign and the high pitch notes. So these are their notes. Maybe I am wrong. I'm not a musician. So what I have a knowledge, I'm going to share it with you. The low pitch sound and the high pitch sound. So when you go from the low pitch sound and the high pitch sound, you see an interval changing of the interval in the pattern of the key. In this way, just imagine this key in the form of this diagram. So it is very important. It is a very easiest topic to know, but again, it has a very deep meaning. So when you imagine this thing on this diagram, you may understand there is a step down between this point and this point. So I'm going to define this and this, what I have to ideally done previously. So this is your acromion process. Acromion process, please, everyone should know which bone forms the acromion process and which bone it is going to be making a joint. So acromioclavicular joint is going to be formed in the anterolateral aspect of any sort of shoulder. Let's say it is a left shoulder. So acromioclavicular joint, it is going to be, it have the superior aspect of the glenohumeral joint. So if it is a form of a, so if this acromioclavicular joint forms the superior aspect of the glenohumeral joint, it has a glenoid, which is a cavity which is holding your humeral head. Now just imagine if there is a deformity, or if there is a ligament rupture which is again connecting the acromion process to the clavicular, or acromion process to the humeral head, or the clavicular lateral aspect to the humeral head, or let's say for an example, a coracohumeral ligament get affected and it may create a step deformity. Again, second concept occur, the piano sign is resulting a step deformity in the anterolateral aspect of the shoulder. So this is what we defined as a piano sign, which result due to the rupture of the acromioclavicular ligament, in which the acromion process go up, leaving the clavicular portion behind, or the disruption of the coracohumeral ligament, which is connecting the coracoid process to the humeral head, again which is going to be impacted and leaving the acromion or the clavicular process superiorly migrating because of the pull of the upper trapezius or or pectoralis minor, not major, minor, which is pulling here from the clavicular portion to the humeral head. Again, it is pulling your clavicular anterior medially toward the joint line, toward the sternum, not toward your axilla or the lower sternal body, toward your upper sternal portion. Now coming to the, let's dissect this more in the form of the radiological sign. So this is a very beautiful picture which is explaining your the acromion process, which is connecting your toward your the clavicle. Now clavicle is going to be superiorly migrate again because of the upper trapezius or the anterior deltoid, because they are going to be inserted or originated toward the lateral aspect of the clavicular, leaving behind the acromion process, which is a part of your scapula and your glenoid cavity and the humeral head. So this is a piano is going to be formed, and if you are a musician, when you are palpating just like a musician, you are going to place your hand over the shoulder just like a musician is going to keep his hand on the piano key. So this is a very beautiful explanation which was given to by my professor, and I am going to forward his knowledge to you. Thank you very much guys. Keep learning, keep sharing.